Hey everyone, our group has Chapter 13, Personal Selling and Sales Promotions. I'm Litzy.
I'm Brandy.
I'm Nick.
Rachel here.
And I'm Chase.
Our article primarily focuses on the impact of personal selling in the healthcare industry, more specifically in the Willis-Knighton health system, and we chose to relate our article to the first chapter objective, discuss the role of a company's salespeople in creating value for customers and building customer relationships.
1.
They are a domineering healthcare group based in Arkansas that was founded in 1924 focusing on communications excellence. The focus on communications excellence is meant as a tool to grow and introduce their product to more customers, with the ultimate goal being to muster up attention and build customer loyalty. The company is locally owned and has a large focus on community. When you look at their website's information, they use the word community about 50 plus times, so it seems to be something they really want to broadcast. Big changes began in the company in the 1970s when they aspired to grow their geographical footprint by first using the hub and spoke model. The hub and spoke model is an important tool for rural hospitals whose communities are often uninsured, poor, and lacking resources to properly fund their hospitals. By attaching many of these small hospitals, the spokes, to larger, well-established hospitals, the hub, you can make sure these communities aren't lacking healthcare opportunities and resources. And they also built more facilities, and that's simply what it says. They would build new facilities in places lacking healthcare. They also expanded via adaptive reuse. Adaptive reuse is the practice of taking old buildings, most commonly in these poorer areas, and converting them into fully functional medical facilities. This is useful in areas like this because it is often cheaper and easier to reuse old infrastructure than to completely start from scratch. So, how has the role of sales agent changed during Willis-Knighton's history? The company originally needed a few very flexible sales agents. They were tiny, even executives had to act like in the role of a sales agent because they were so stretched. But later the company's growth allowed for more specialization. During this specialization period, personal selling was a focus, which led to the role of the business development officer. Their job was to find influencers within the community, including church leaders, businesses, and community organizations. This built goodwill within the community and helped WKHS become more a part of the community. This intimacy helped them navigate the complex market that they worked within. It allowed for more streamlined and direct engagement with their patrons.
Transitioning to their personal selling strategy strengths. First is the potential to network and build relationships. Their health system sales agents develop closer business relationships with patients and clients through personal interactions. And as they flourish, it opens the door for networking and communication with a wider range of targeted audiences. Long-standing professional partnerships help them gain credibility in the industry. It's much easier for their salesmen to showcase valuable contributions when their customers already associate their reliability with that human connection. They've even found that they can make more amicable, mutually beneficial exchanges. Additionally, in terms of engagement flexibility, health agents tend to prefer the open dialogue because it allows them to dissuade negative perceptions using the correct engagement avenue, and they get faster patient and client feedback. It doesn't diminish the vitality of the non-personable marketing tools they use, like newspaper press releases. It actually substantiates them by allowing patients to ask questions about service value and receive the follow-up responses conveniently in real time by the faces of the health system. Lastly, the potential to add to market intelligence. During personal selling ventures, healthcare sales agents are directly exposed to opportunities for market intelligence collection. When they speak to target audiences, they play a vital role in gathering that information so WKHS can use it. As a potential future administrator, the role of salesman in gaining those leads are imperative to us and health systems across the board because it's used in decision-making for customer value, quality improvement, changes to medical services, and competitive threats. It's a bureaucratic system, so these findings help administrators come up with appeal tactics to fight off competitors and improve customer value.
Businesses have to print large quantities of information for training purposes to prevent miscommunication from taking place. Having a small reach means spending more on advertising to reach new customers. Not taking both of these into account can be seen as a weakness, which in turn will lead to less customers.
A company's sales force communicates the value of a product to a customer whilst building a personal relationship. WKHS provides many training programs for all their staff, involving many healthcare professionals that are connected within the specific system to help advance and improve their personal selling experience. WKHS advises when implementing any component of the marketing communications mix, one should establish a baseline foundation of resources. The first, including top leadership support and commitment. The second, financial resources adequate for funding communications activities. The third, competent personnel who have been given communicative goals to achieve. And four, formal processes permitting effective planning, implementation, and evaluation of initiatives. A way to avoid missed opportunities with potential customers is to ensure personnel selling is executed properly. All health organizations must identify every employee who can and are being utilized in personal selling initiatives. Once this is done, the company should seek full engagement from these employees in marketing communications planning. The frequent use of this technique creates an equipped workforce that can act as an informed resources and assist an organization reaching its personal sales goals. A way that WKHS provides for their communities is through different promotion mixes, including discounts for free screenings. For example, WKHS offers Melanoma Mondays, meaning free screenings for a melanoma, a deadly skin cancer on Mondays free of charge for its patients or for those wanting a screening. This specific tactic increases engagement with customers, new and old alike, and maximizes utilization of all resources. This is only one example of the various tactics this organization integrates and uses that benefits the organization as a whole. This health system is a major community supporter through its Tide the Bottom Line philanthropy that provides funding and support to the community. A major component of this is Project Neighborhood Health, which targets medically underserved areas.
And lastly, our interactive Q&A. First, how could a healthcare sales agent use the engagement flexibility afforded by personal selling to their advantage during the ongoing pandemic? Remember that most employees are in a remote working environment.
The second is, what would you say is a common misconception of an in-person sales employee? Why could that be a common occurrence, and how does it affect public perception of the workforce?
And number 3, how has the digital age impacted the role of sales agents and their implementation of personal selling? What hasn't changed?